Are you a radiologist working in different hospitals? Yes, then you will agree that every hospital don't have similar type of machines, and hence possibility of missing out something during scanning technique is most common. But don't worry. Today I'm going to tell you about some simple techniques for sonography scanning. Hi, I'm Dr. Dipankar Chaudhary. I am a radiologist working in Mumbai. And trust me, all these techniques which I'm going to tell you today is through my gathered experience of 21 years. So let's start with upper abdomen sonography today. So before starting everything, we will first understand what is the ground rule for sonography. And the first ground rule is for upper abdomen sonography is patient should be NBM, that is nil by mouth. Second ground rule for whole sonography is patient should have full bladder. Third is you need to be in a comfortable position while doing the sonography. Fourth thing is as a sonologist, if you're doing if as a male sonologist, if you're doing a sonography for a female, you should have a female attendant with you. And last and the most important ground rule is if you want to touch the patient, don't touch your patient with bare hands. Always use gloves for touching patient. So now coming to the next step. First, I would like to tell you why I got this idea of creating video. While doing sonographies, I realized that patient, when I do sonography, patient is very satisfied and they give me feedback that you are a very good sonologist. And after paying so much amount of money for sonography, they feel satisfaction, and that is the reason I thought I should share my experience to most of the radiologists. That is the reason why I started doing these steps. Now, step 1. Step 1 is doing starting sonography. Always start sonography from epigastric region. Epigastric region, you have to look for pancreas, left lobe of liver, aorta. After you look for pancreas, left lobe of liver and aorta, interact with patient. How do you interact with patient? Interaction with patient is ask patient if he has any problem in this area. Then tell the patient to turn little bit on the left side, oblique view. Start looking for gallbladder and all related areas around gallbladder. Then tell patient, this is the step number 3. Tell patient to move more on the left side and start looking for liver and kidney. Ask patient, here you have to interact by asking patient to take deep breath and hold it. Take a size of kidney and then tell him to release the breath. This breath holding process will always help patient to get satisfaction. Now, step 4 is make the patient to turn on right side, completely on the right side. Start taking size of the liver, spleen, left kidney, and again tell him to take deep breath and hold it. Measure the size of kidney, look for other organs, any problem, any calculi. Here you can ask patient if he has any stone problem previously. Now make the patient to sleep straight and start looking for mid abdomen and lower abdomen slowly and steadily on both iliac fossa, and then ask patient where is the pain exactly. And the final thing is the main important thing. Patient complains of pain in mid abdomen. Put your probe exactly in the position where the patient is having pain and press it and ask him whether he has a pain over there. As soon as you put the probe over there and you start looking over there, patient feels satisfaction that something has done with me. And this is the basic steps which you have to do it. So final conclusion. While you are doing sonographies, I have given some ideas about interaction. And when you interact regularly with patient, there are two things which happens. First is patient get complete satisfaction, and second most important thing is patient gives you proper history. And if patient gives you proper history, you are definitely not going to miss any point in his sonography techniques. So remember always, interaction is the most important part in doing sonography, and the way you interact and the way you talk with patient is always important. So I hope you have understood everything about the techniques of sonography and the interaction you do with the patient, right? So let's try it and give me some feedbacks about it.